ketamine is all the rage these days. I think
Right.
there's a lot of hope. We were talking about the hope of getting better and these treatments. And so I think there's a lot of enthusiasm. People that are looking for something that is working.
Welcome to Stronger with Every Session. This is your space for candid conversations, deep dives into crucial topics, and practical education you can use to transform your life. Together, we are stronger with every session. Welcome to Stronger with Every Session, a podcast by Renew Hope and Healing. If you're somebody who feels like they've tried everything and they're still searching for relief, this episode is for you. Today's guest is somebody who's redefining what's possible in mental health care. We're honored to welcome Dr. Shane Stegen, a board-certified psychiatrist and founder of Nexus Neuropsychiatry, right here in Rochester, New York. Dr. Stegen specializes in interventional psychiatry, a field that blends science, technology, and innovation to treat complex mental health conditions at the brain level. His clinical work, research, and public education efforts have made him a leading voice in this emerging space. His work is bringing new hope and healing to our community. Whether you're a clinician, a caregiver, or somebody looking for answers, this conversation will give you a powerful look at the future of mental health care, already happening right here in Rochester. Welcome to the show, Dr. Stegen.
Thanks so much for having me.
Can you explain what neuropsychiatry is and how it's different than general psychiatry or neurology?
Yeah, neuropsychiatry, really, we're basically the nexus, if you will, of neuroscience and all of the new research and the brain and traditional psychiatry. So we're really blending the interventions and ways that we can treat people that are not as known.
Awesome. What led you to focus on this niche?
How? So, okay, it really goes back to after I finished residency, a bunch of colleagues of mine were just sitting around and they said, wouldn't it be fun to do some of these treatments that no one really has access to? And so it went on from there. Kind of started out as just a pie in the sky dream, and we started with our first TMS machine and just have been growing since then, partly just because we love treating patients and getting people better and just seeing the need in the Rochester area that people weren't able really to access these types.
So with the TMS treatment, I'm curious, who can get this treatment? Like, who benefits? And that's probably a really big question, but this sounds pretty cutting edge, and I think a lot of people can benefit. So who are some of those people?
Yeah, it really depends on which treatment that you're talking about, because it's right now it's indicated by the FDA for depression and OCD, but there's a lot of stuff coming on the horizon in research that we're looking at. We're hopeful that it will be more mainstream, but right now it's generally restricted for, at least for insurance payments, depression and OCD, but there's a lot of hope for some other different problems such as ADHD, some autism protocols, PTSD protocols. It does have actually an FDA indication for smoking cessation.
Really?
Yeah, so there's a lot of things, and part of that just is how TMS works, right? We're basically using a magnetic field to fire neurons in your brain, and it's not a very deep stimulation, but basically anywhere in the cortex that you can reach with that stimulation, you can have some way to either excite or inhibit how those neurons fire. So it's a really cool treatment. It has a lot of possibilities, and part of it is we just don't know that much of how to apply it in a clinical setting with the research. So it's really an up and coming field.
It sounds like there's a lot of hope, though. It's a really hopeful treatment.
It is, yeah.
So when you're saying TMS and magnetic treatment, my mind goes to the tinfoil stuff and like magnets. And so like, what does it actually look like? How does it work?
Yeah, so actually I brought a coil with me. So that obviously this would be attached to an actual machine. This is one that was broken that my guy cut it off. But yeah, so this is actually a real TMS coil. And what it is and what it's doing is you're running a very high voltage current through a coil of wire.
Right.
And it's inducing a magnetic field. And if you remember back from science class, if you coil the wire and put a magnet through it, you can make electricity move.
Yes.
We're doing that with your neurons. So we're firing your neurons. So if you take that coil
Yeah.
I put it on your motor cortex. That can make you pump, can make your hand move
Really?
without touching you, but we can fire your neurons. So if we fire them in certain patterns, it can induce neuroplasticity and excite places that are hypoactive in some ways, or inhibit other places that are firing too much. So in depression, we know that parts of the brain are hypo, they're not working the way they should be. So we aim at those places and try to turn them on.
That's incredible.
So what does that feel like for somebody who's going through the treatment? Does it hurt? Do they have any kind of?
It's pretty well tolerated for most people. And we treat a lot of patients in our office. We're basically the largest TMS provider in the Rochester area. And we've had maybe a handful of patients that have ever said, no, absolutely not. I can't do that. I tell people a lot of times patients will say, it's comfortable. I wouldn't do it for free. But if it's experiencing the symptoms that I have versus trying to get better, a lot of people are able to tolerate it.
Is there like a sensation that you feel?
Yeah, it's an odd sensation in terms of it can be a tapping or a pecking. Some people are a little bit more dramatic and say, oh, it's like a stabbing or a sharp pain. But for most people, it's pretty tolerable to the point that I talked about firing your motor cortex. We practice on each other. So I've been under the coil before. It's something that you can feel and do, and it's really not that adverse.
So you've done it before, and I love that too, because I think whenever there's a new treatment, right, having somebody that actually has experienced it and do it, it makes people feel more comfortable. Like you're not just talking about what it feels like, the process personally as well.
Absolutely. Yeah. I think that there's something about any treatment that when you go to a doctor, if they can say, I would treat my family, my friend with this is something that, not that you want to believe in something science, we should be looking at evidence, looking at research to have something that I can really recommend to my patients that I really trust that it's safe.
Yes.
And it's a really insulting treatment that up until this point, once medications don't work, we know from the STAR-D trials 30 years ago that once you get to medication number 2, number 3, number 4, the likelihood of the next one working is single-digit probabilities. And then outside of that, before TMS, before Spravato, before all these other neuromodulation or interventional psychiatry treatments, the only other option is ECT. And ECT is still done these days. I'm still a provider of ECT myself. I don't recommend it to a lot of my patients because the side effects are significant. Very effective. But
I'm not familiar with ECT.
Electroconvulsive therapy. So shock therapy.
Okay.
Talks about, they don't call it shock therapy anymore. And it's not as dramatic as the movies. We do what we call modified ECT now, where we anesthetize the patient, we paralyze their muscles, so they do not feel it, they're not going to harm themselves, but still you're going under anesthesia 3 times a week. You're getting IVs, you're being put to sleep, you're being there's a lot of side effects that come along with it.
And to your point, the clients that I've treated that have had that treatment, they often have said a lot of experiencing memory issues. So side effects for TMS, are there any side effects?
So most of the side effects for TMS are basically the tolerability of it while you're in the chair getting the treatment, which is very brief, by the way. We have the capability in our office to do theta bursts. Treatments are anywhere between 3 and 8 minutes.
Oh my gosh.
So you're in the chair for a few minutes, get a little bendy toy, get a stress ball, play some music. Some people AC/DC or something heavy. Some people want to chill out. Some people read their Buddhist mantras. So it's pretty tolerable. So it's uncomfortable for a few minutes. Some people might get a little headache. I say little in that it's brief, it's time limited, 20 minutes or so, but most people tolerate it really well. And after you leave the office, there's no systemic anything. There's no medication involved. There's no sedation involved. So you can go right back to work, right back to play, and drive your cell phone. So it's a really accessible treatment in that sense. People for a 15-minute appointment once a day for a few weeks. And that's usually the biggest negatives of TMS is just the time commitment of getting to our office that many times. When I say that many times, it's about 36 treatments.
Is that the standard?
Yeah, that's the standard depression protocol. It's about 36 treatments. Some people most people will respond in that. Some people might need a few more than that to get where they need to be. But when we talk about the effectiveness of it, though, ECT is somewhere in the 80% response for TMS is approaching that these days. And what's really exciting is the accelerated protocols and all this other stuff. I can go all, so I can go all into what's on the horizon for what's going to enhance those numbers. But even as it stands, the FDA protocols like really don't respond to refractory depression. Those are the people that, if you try another med, want attention, but they get any.
And to your point to that, I appreciate this so much because often when we do have clients, right, that have gone through a couple medications, we always want to be able to give hope, right, and real hope. And so having something like TMS, it's great because if you're struggling and if you're starting to go, gosh, this hasn't worked, this hasn't worked, this hasn't worked, there's something else that you can try that is up and coming and is very promising.
And it sounds like it's really non-invasive compared to...
And that's what we do at Nexus in my practice. Like we are always looking for the other things that we can add to other treatment teams. Not everyone can get these machines in their office, but so we don't do any primary management ourselves, but we're always looking for other things that we can help other clinicians, patients that are running out of hope.
Yeah.
So that we started with TMS, we offer Spravato, which is nasal esketamine. We're looking at adding VNS, which is vagal nerve stimulation. Short term, we're going to have IV ketamine coming online soon. So we have a lot of treatments in our office that we're looking to provide to the community just because they're not accessible in a safe way or just covered by insurance.
So TMS is covered by insurance?
It is, yeah. Wow. So as long as you have the correct plan and it's in the fine print, which is something that insurance these days, we always have to do the verification of benefits, but most commercial plans, a lot of Medicare covers it, a number of Medicaids cover it these days. As long as you meet criteria for treatment refractory depression or treatment refractory OCD, you can get it covered by insurance.
And that's based on a failed medication trials?
Yeah, generally you need to have at least whatever they have decided, the insurance company specifically decided is treatment refractory. So some will say 2, some will say 4, some will say 2 and 2 augmentation. And then usually they want to see that you've done psychotherapy as well. You've done the things that are first line or depression not working before you're doing this more intensive. For a lot of people, that's a pretty low bar. We see most of the people that we've seen, I've gone down with, we do our screeners and I've checked every single box on almost every medication that is approved for depression they have been on. So I've seen patients that have blown it out of the water. Sometimes I have to be going and looking up these obscure medications.
Yeah.
They're now off the market because they've tried.
Oh, wow. Yeah.
That's what I'm saying. Something.
Yeah. So it's really, that makes us feel good too, in terms of we're able to get to patients that have not gotten relief. They don't get, honestly, one of the blessings and the negatives that we found out starting to do this treatment is that a lot of people, they get better and they don't know what good looks like.
Yeah.
That's such a good point.
I'm always saying you need to have a really good therapist and going during TMS because when you get better, like
you have to reintegrate.
And so it's like this novel thing. It causes a shift in their life. All of a sudden they're getting up and they're going out.
Yeah, it's huge, right? Like your identity even, because you're right, like when you suffer from OCD or depression, right? It can feel like it's a part of who you are when really, you know, who you are, I believe can be very separate from depression and OCD. And that can almost mask, right? Or numb who you are.
Person is.
And
you have to go out and discover it.
Yeah.
I feel like after 2 or more failed medications, I feel like a lot of people probably just accept that's who they are now. I'm just a sad person. And
yeah, it can be a very sad thing for it to, and then it get incorporated and causes the cycle. That's one of the things we like watching that change happen, but also it takes a whole team to manage those patients because they're getting better also. So we're always referring to therapists.
Yeah.
Making sure that people are connected. We can't do this alone or anything.
So it sounds like you've had a lot of success stories come out of TMS treatment.
Oh yeah. I mean, the response and remission rates are astounding, especially coming from even just regular treatment as usual, people that are responding, even that first antidepressant, right? 30-40% of people get benefit out of that first antidepressant. That's not great. Like
no,
failing in school, right? Like, not winning. And so when you go to the doctor and you ask for your Prozac the first time because you're not doing well, and they're like, oh yeah, here you go. This will treat your depression. They don't tell you.
It's like maybe it will.
Yeah.
Fair point too. Like this kind of makes me wonder, right? So for like medication management, usually for an antidepressant, you have to take something, right? Now with TMS, once you're done with treatment and it's successful, how long do those effects last?
Durability is a great question. So
Yeah.
that TMS is one of the first things coming on the market now that's about, it's a new field that we're
Right,
getting into
right.
called neuromodulation. It's actually bigger than psychiatry. Like biology is doing it, psychiatry is doing it, neurosurgery is doing it.
Wow.
So the idea of TMS is that we're not just firing neurons once, we're inducing some neuroplasticity. And so that we're inducing a change in your brain that makes you not have those symptoms. But then the hope is that we do this acute course and then we finish.
Yeah.
And you should maintain that durability for some amount of
You
time.
know, the way that you just explained that too, it just clicked for me because when we talk about neuroplasticity, in my training, like what I have learned is that over time, right, you can't stretch as much, those neurons, right? And so that's amazing. So is there an age range or an age cutoff for this?
For patients so in terms of safety, I think most of the studies are down to late adolescence. So it is FDA approved down to 15 for depression.
Oh, wow.
But they've done studies on even younger than that. So it's quite a safe treatment.
Yeah.
And then even for the elderly population, there's no cutoff at the other end too. So we've treated people at end of life too.
That's
that have been
incredible.
really acceptable, but they don't have much time left.
Right.
And they know that, and they're dealing with a lot of medical complications.
Yeah.
You can't just load on medication when you have a list that's this long, but this is not a medication. It does not have systemic side effects. So we've been able to treat those patients. And going back to your durability question, though, is like once you do that acute course, the studies, at least for depression, say 1 to 2 years of effectiveness, if not more.
Wow.
And then the cool thing is, if that was to wane, what we know about mood disorders, right, is if you had a mood disorder or an episode in the past, potentially that you are, after you have one diagnosis of an episode of depression, you're more likely to have one later in your life.
Right,
So you can get depression again. You can get TMS again. You can turn that part of your brain on again. So it really is not limited to, did this work or not? If it worked, it's on the table again in the future for And insurance companies actually are pretty quick to authorize, in our experience, a retreatment because you've tried all these other things that cost a lot of money. All of a sudden, you found something that works. And they're like, do it. Yeah, it's a really good option for people that works.
So what is the difference between TMS and Spravato?
So Spravato is a medication.
Okay.
But it's working similarly in the same theories in that we're trying to induce neuroplasticity or neuromodulators. And Spravato is pretty cool because it's the first medication on the market that's actually working in the glutamate system. So it's very different than any other medication that we've had prior to this. I know there's been IV ketamine around for years, and we've known that it treats depression. Spravato has been formulated to be kind of a safer, more accessible option, and it's covered by insurance. So
what's safer about it?
So it's safer in that it's a metered dose, and that it's being administered in a way that's more bioavailable from people doing strokes or IM is a little bit better. IV is the best, ideally, but it also requires the most medicals to do this. You're right. That could be an option, but have the medical personnel and ACLS capabilities. It can cause cardiac issues.
Okay. Yep.
Which the nasal ketamine can cause some blood pressure, but it's not like you need to have life support. In that sense, it's safer, more well tolerated, more accessible in a lot of places to offer.
So it's a nasal spray?
It's a nasal spray. I also have one of those. I brought my toys today. So,
awesome.
So this is this is a dummy one. I'm not going to actually waste medication, but this is what it looks like. It looks like Flonase or a little thing.
Yeah.
Put it in your nostril and pop it.
So this treatment, is it in office as well, or is this so this is still in office?
Yeah,
that
so
you would do the treatment.
So Spravato is a treatment where you come into the office, and because of the rise in blood pressure, and because at high doses, you know that ketamine is a dissociative anesthetic, so it can make people dissociate, and it could also make people really sedated. This is a very metered and a smaller dose. They consider those side effects of the Spravato, but we monitor for about 2 hours to make sure your blood pressure. Yeah, so your blood pressure is at baseline before you start, and it goes back by the end, and that you're not super sedated or not able to really care for yourself or to leave the office. But generally, most everyone within 2 hours, as long as there's not another medication in their system that will synergize with both. And even then, we just monitor those.
So when you're going through this treatment, you mentioned being sedated. What does somebody typically experience? Is it just sedation? Is there like feeling of peace? What is it?
Yeah, I think most people, they come in with a lot of thoughts and ideas about what they might be experienced, but it's pretty low key. Most people come in, they get their dose of Spravato, and then they pull out their phone and they fiddle for a while. Most will take a nap somewhere between 45 minutes and an hour, and they wake up, and some people are a little groggy, but for most people, it's well tolerated. The dissociation that most people are like, they will say, oh, I feel floaty.
Floaty. Okay.
If they potentially have it.
Okay.
So it's pretty mild. We're not getting high in the office. Have it going on these trips or anything. So it's a lot more metered. And the idea is for that neuroplasticity. So when we're dosing it, we dose it twice a week.
Twice a week.
For the induction phase, actually, that's a lot longer than the half-life. It's actually out of your system by the time you treat the next time.
Wow. Okay.
So it's not active the whole time. We're counting on that neuroplasticity to be turning on the brain, not to have this medication or serum going through your body.
Okay. I've heard so much about ketamine treatment, and I've never heard it explained that way. That's really interesting.
So what I have heard ketamine referred to as milk of amnesia, because like you said, it can cause some of that disassociation. So what is the dosing difference between this and if someone was having that?
So like an IV ketamine or using it as an anesthetic, you're using a much higher dose. And so at high doses, it will cause dissociation. But what they've seen with the Spravato is they're dosing it low enough that by that end of the 2 hours, you're back to your cognitive baseline. You can go do math problems if you so desire. You should be able to do them just as well as before you Spravato. Whereas like for IV ketamine, if you go and have a surgery done and they're cutting into you, you don't want to remember that. They're going to use a higher dose. That's the difference. But ultimately, what people would say is even if you're using that higher dose, there still would be that neuroplasticity effect. Well, why would you need such a high dose if that's all you're looking for? So that's why it's a low dose. Everything in medicine is looking at the risks, the benefits, and so we're always trying to minimize them. So some people that might not respond to other interventions, they might not respond to Spravato. Maybe IV ketamine at a higher dose would be a good option for them. Hearing more about it. It's just like ECT might be a better option for someone that's not responding to this or TMS, but it comes with a heavier price.
That makes sense. So are there requirements for this similar to TMS for people who would be a good candidate?
Spravato is slightly different because it's a medication, and so it does raise your blood pressure. So things like a history of stroke or problems, cardiac or problems that would be related to that. We would want to be more careful, get cardiology clearance potentially. So that's a little bit different, but from a diagnosis standpoint, it's treatment refractory depression, very similar. For the depression, for the palsy treatment.
And is that what Spravato treats, is the treatment-resistant depression?
It has two indications. It's for treatment refractory depression and actually acute suicidal ideation.
Oh, okay.
That will treat.
How long does it take for Spravato to start kicking in, like where people notice a change?
That's a great question. Spravato, initially, I think there was a lot of hope that it would be similar to IV ketamine, and so that some people will have response very quickly in the first week or so. We've also been seeing it in clinical practice. There is some cumulative effect of that neuromodulation, and so some people are still getting better a couple of weeks, whereas IV ketamine at the higher doses, I'll just throw it again. The higher doses of IV ketamine, we do know that it works very quickly. But again, risk benefit. Do we want to get it better quickly and have all the risks? That's an individual. That's between you and your doctor and what is the best thing?
Treat.
Typical medications, though, that's 6 weeks that it takes before you start seeing full effects.
4 to 6 weeks or longer.
Or
longer. That's the minimum that we should see signal. And TMS is quick too. And we want to see a signal, at least some movement in your mood by week 2 or 3.
Yeah.
As we start wondering,
Yeah.
okay, what is the next step?
I feel like we need to be talking about these treatments more. There's so many people I'm sure all of us have come in contact with in our personal lives, professional lives, where you want to help so much. And I'm so glad that Nexus exists and that we're able to talk about this stuff today, because I don't know about you, but you probably know a whole bunch of people that you feel like, right?
Oh, yeah.
This.
Yeah, I know a lot of people who have suffered from depression, and it gets to a point, like I said before, where you feel like that's just who you are. And if there's not a solution, then
It's funny because a lot of times when I do educational material, other providers, I usually start out, we can go down all kinds of tracks about talking about OCD.
Yeah,
And stuff.
yeah.
I usually start out with depression because I make a joke because like depression is bad.
Yeah.
Because it's bad. It's usually the number 1 or 2 leading cause of disability. The worst.
Oh, wow.
In terms of a lifetime incidence and prevalence, it is the most costly and widespread, both for mental health and also of all
Yes.
diseases.
Yeah.
And it causes such a burden on our society, on our economics, and really we can't treat it all that well with the standard first line treatments. So
yeah.
it's bad.
And there's not enough, people definitely don't talk about different treatment options enough. Like you said, you go to your doctor, you ask for Prozac, and then you think that's where you are. It
And that
works or it doesn't.
Yeah,
and if it doesn't, then
yeah, and I think part of it's a lack of education. That's one thing that, partly why I'm here talking with you.
Yeah.
I talk about it a lot all day, every day, pretty much now these days, because people just don't know about it. I was delivering ECT and there was an anesthesiologist in the room with me.
Yeah.
He's like, that's a thing? And I was
Right.
like, oh yeah, that's a thing. And he's working in interventional
oh,
psychiatry.
yeah.
A doctor that, and I wouldn't say doctors should know about it, but they should.
Yeah. I know even a lot of our therapists here were not familiar with it. As I was bragging about you coming on the show, they were like, oh yeah, what
That's
is
the thing.
TMS?
That's the thing? Yeah.
Yeah.
And it's sad because really Anthony Barker was the one that came up with the way to do this in 1985. This has
Wow.
been around for a really long time, the concept. It took many years for them to get over the engineering, because these coils, you can probably, you can see it, but they're actually liquid cool, so they don't overheat because you're running a lot of current through them. So it was many years before they could figure out how to fire the coil the right number of times without it overheating to actually treat it. But it was approved in 2008.
Wow.
For depression.
They-
And yet, one of the first time, that anyone got a TMS treatment in
Yeah.
Rochester, probably not.
Right. And
Yeah.
in years of education, we have classes on
Yeah.
medications, and I can't remember learning about this, honestly. So this is great, because hopefully this isn't just going to reach our clients, but it also reach maybe future therapists and a litany of professionals.
Yeah, and it's the things that they're doing these days.
Yeah.
It's like an old man a little bit, but these days. But no, I just came back from San Diego. I was at the annual meeting for the Clinical TMS Society, and it was all about neuromodulation. And now they're combining medications, Vyvanse and D-cycloserine, with accelerated protocols. They have a 1-day protocol for depression that is
What?
just as effective as our 36 treatments. You could treat someone for 1 day.
That's
That's
incredible.
fast acting. That is something that when depression is bad, that's kind of what we need
Right.
these days. These accelerated treatments, they were talking too about using medications
Yeah.
to reduce the neuroplasticity and that's firing the brain. It doesn't just accelerate the treatment, it actually makes it more durable.
Yeah.
It makes it more effective. It enhances.
What other advances are coming down the line that you're...
So I think there's a lot in the field of neuromodulation, the field of interventional psychiatry. There's a lot of things that are coming down the pike. We mentioned accelerated protocols, all these enhancements of TMS with medications to modulate the efficacy, durability. I think that there's other things that we're bringing into Rochester. So we're working on bringing vagal nerve stimulation into our office, potentially stellate ganglion blocks. Some of the accelerated protocols, obviously. We've already run some accelerated protocols. We're looking at augmenting and changing that stuff. And I think there's a lot of hope around all of the research in the psychedelic space as well. There's a lot to be hopeful for in the area of interventional psychiatry and treatment of depression, and hopefully just other indications.
Yeah.
giving people a lot more options.
A lot more options, yeah. And I think that's what we were here to do, is
Right.
basically bring this to Rochester. And some of these things are hard to roll out.
Yeah.
If you're I know a lot of our best referral sources are the very experienced psychiatrists that trained us at Strong. And so they have private practices, but they're full. They're seeing patients all day. They don't have time to be figuring out how to do the actual interventions in their office. So that's where we come in, and that we have the mind space to be able to roll these things out for Rochester and really get people better that are not able to at the first line.
Are people afraid of these treatments, or is there like fear surrounding it?
I think there's a certain amount of, there's always stigma about mental illness.
Yep.
But one of the hardest things that anyone ever does is admitting that they need help in walking through that door. And so when you're walking in through that door repeatedly, and now that we're a new door that you're walking through, so I think there's always some anxiety about that. If we're doing things that are not as known, like that I know that the side effect profile is really good for TMS. I would put my friends and family in that chair in a second.
It's a strong statement. Yeah.
Absolutely. And I have. But for someone that doesn't know, it looks scary.
Right.
We're messing with your brain.
So with that, like if you were to do, that's very heavy. Okay.
Yeah.
So seriously, does it go on your head? Like how does this?
Yeah. So actually, this is actually quite clamps in kind of a boom like arm like this.
Yeah.
Then it's held on the prefrontal cortex.
It's actually going against.
It actually contacts your scalp. The closer we can get it, the more exact we can get. And we map people out, and there's a very specific way and where we stimulate and how we stimulate with the coils. But it sounds scary, but really it's most people that have a lot of anxiety about it. They come in once they see the setup. I show it to them on their arm. I can stimulate any nerves. So I just show it to them on their arm. I show them machine. We are very experienced in what we do. We treat at Nexus. We treat more than everybody else in Rochester combined. All the other providers, like we have a pretty large operation these days in terms of the number of patients we see every day. So we have the most experienced people. Our techs and nurses are amazing. So most people feel pretty well at ease by the time it comes to actually delivering treatment.
Sold. So when somebody does this bravado treatment, like, are you administering it, or do
they get to spray themselves? Yeah, there's a couple patients that we have that they have other medical reasons that they can't work the sprayer very well, and we'll do it. But most people, it's a little bit more comfortable that
for them
getting right in your face and giving the sprays. But yeah, people give them
and it goes in each.
Yep, each nostril. And then you wait 5 minutes for it to dry out, and then there's a second device. So depending on your dose, there might be 2 or 3 devices that you spray, and it's every 5 minutes.
Gotcha.
So you'll spray and then wait 5 minutes to spray a second time. And then if you're using a third device, 5 more minutes to spray the third one, and then you can chill out, get your blood pressure taken once or twice, and you make sure you look good.
Yeah.
You always see your provider before you leave to make sure that wonky is going on, but generally people make sure people are safe.
I've seen ads for ketamine prescriptions that you can get mailed to you at home. What do you think about those?
That's kind of a loaded question. I think ketamine is all the rage these days. There's a lot of hope. We were talking about the hope of getting better and these treatments. And so I think there's a lot of enthusiasm. People that are looking for something that is working. I would remind people that these are medications that have high doses. They're dissociative anesthetics. They're not, that we talked about benefits and risks of decision making. Like, there are risks that come along with this. I think that when you're mailing a controlled substance that has high abuse potential based off a telehealth visit and to be administered in an uncontrolled medical setting, I have concerns. I wouldn't recommend it to my patients. I would not be doing it on my license. But I also understand people's enthusiasm. I think I have a great personal enthusiasm and hope for the future with all the stuff that's coming through with both ketamine and synthetic psilocybin trials and the LSD trials for anxiety. They're doing some great research, and we can have all the personal enthusiasm in the world about this, but on the professional side, we need to make sure that it's both safe and efficacious. So I can recommend it as a doctor.
100%.
And then that's the difference between Spravato and these mail order based. It's like I have the backing of the FDA and the research and safety evidence. And even for IV, even though that's an off-label use, there's a lot of research for the psychiatric uses of IV ketamine in a monitored setting where we have life support capabilities. It's different than mailing it over.
Yeah, I mean, that's, like you said, mailing a controlled substance with no It sounds like it has a lot of room for error.
Room for error, there's risks. So I don't ever want to be, I think that the opposing camp is like you're blocking people's treatment or keeping people from getting better. And I hear that too. I understand that. But there are also people that doing ketamine-assisted psychotherapy that use a local compounding pharmacy and administer it in the office with blood pressure. And they might not be a medical professional,
Right.
but they're taking some precaution.
Yeah,
It feels
right.
different to me. So I think there's a big spectrum, again, go back to benefits and risks about how loose do we want to be with safety restriction when people are suffering.
Yeah.
Depression is bad.
Yeah.
but it sounds like Spravato is accessible enough. That's not even something that people need.
I think it sounds like it, but we have only been offering Spravato for less than a year at this point. So I don't think it has been very accessible up to this point. Right.
Yeah.
Why we're on the map right now is because we looked around as psychiatrists and been like, oh my goodness, there's nobody doing this. Why is no one? That was literally the conversation I had while I was rounding one day with my colleague, being like, why is nobody doing it? We could do this ourselves.
Right.
So here we are. But yeah, part of it's depression's bad, and we're in desperate times with an epidemic of mental health needs and not a lot of clinicians, both psychiatrically and psychotherapy ends.
Yeah.
It's hard. So I don't blame anyone. If they want to put their license on the line and mail it out, that's between them and their patient and their own standard. I do. Times.
Is there anything else that you think is important for our viewers to know about these?
I think we covered a lot of space, but I think the biggest thing is just don't give up hope. There's a lot of stuff out there. I think, like you were saying, it's scary to walk through the door sometimes, but start a conversation. But if your doctor or your therapist doesn't know, reach out to people that do. I think I could talk about this stuff with you guys for probably 2 days.
Yeah.
Call us up. We'll be happy to chat about what it is and how it works. And if it's an option for you, and if it's not, now it might be in the future. And I think it's you were saying before about alternative treatments. I'm not an MD. I was trained in the osteopathic philosophy of medicine, which is a lot more holistic. And some people would say it's semantics. University of Rochester is a very holistic allopathic school. But so I think when you're approaching interventional, we're thinking every possible angle of how we can get someone better. And if we can get that into Rochester, we're going to try.
Yeah.
So if it's not here yet, we're going to probably, you can count on us. We're trying to get it.
That's amazing. Dr. Stegen, you mentioned you went to a new location. Where is your new location, just so people...
Oh yeah, so we're in a really nice space that's just off of Wilton Road, just south of 5-9.
Okay.
Corner of right area of Town Line Road, and we'll talk back in a little office park called Canal View. So nice, plenty of parking. Come visit us.
Yeah, I'll definitely be swinging by.
Yeah.
Me too.
Yeah, it's going to be a nice place of growth for us. I think packed in where we started working. We all had day jobs and are working this just at night because for 2 hours a night because we wanted to treat patients. And now we're actually open for business during the day, and we have someone answering the phone. And we started by doing everything ourselves. I programmed the computers, we set up the things, I took out the trash. So it's been really a grassroots approach in our office that we're offering these types of treatments, and we're not a big institution. You don't have to plug in a garage. They can be accessible and they can be comfortable to we want people to come in and get better, but also it doesn't have to feel austere. So our space is great. I'm excited for the future.
Awesome. Thank you so much for being on the show. I think that this is really important for information for the community to have, and I'm excited for us to be able to share that. Thanks for joining us today on Stronger with Every Session, a podcast by Renew Hope and Healing. If today's episode taught you something new or helped you see mental health in a new light, share it with somebody else to help them grow too.